When nurses first begin working in the MDS role, skilled admissions can feel confusing. Hospital documentation may include multiple diagnoses, treatments, and clinical details that all need to be reviewed. But experienced MDS coordinators usually follow a structured process when reviewing referrals. That process helps determine whether the resident meets skilled criteria and whether the admission is appropriate for the facility. The first step in reviewing a referral is usually checking a few basic pieces of information. Many coordinators start by identifying the payer source, such as traditional Medicare or a managed care plan. They also review why the resident was hospitalized and whether the resident is receiving treatments like oxygen or IV fluids. These early details help determine whether the referral may involve skilled services. The next step is determining whether the resident requires skilled services. In many cases, this may involve therapy services following surgery, fractures, or neurologic conditions. In other situations, skilled nursing care may be required for complex medical conditions, IV medications, wound care, or other treatments. Understanding the skilled need helps guide the rest of the admission review. Once skilled need is identified, the hospital documentation is reviewed more closely. This may include discharge summaries, physician documentation, therapy evaluations, and procedure notes. During this stage, coordinators often begin compiling the resident's active diagnoses and identifying conditions that may affect the skilled stay. Hospital therapy evaluations are also helpful because they often describe the resident's prior level of function. Another important step is identifying the diagnosis that represents the reason for the skilled stay. Hospital records may list many diagnoses, but the primary diagnosis should reflect the condition requiring skilled services. This diagnosis will later influence the resident's clinical category under PDPM. During referral review, experienced coordinators are often watching for clinical details that may affect the PDPM classification. This can include recent surgeries, fractures, neurologic conditions, dialysis, IV medications, major wounds, or parenteral nutrition. Identifying these factors early helps coordinators anticipate how the resident may be classified once admitted. Referral review may also include considering how the resident's needs align with the payer source. For example, managed care stays are often shorter and may involve different reimbursement structures. High-cost treatments or services may affect whether the admission is financially appropriate for the facility. Because of this, admission decisions often involve collaboration between nursing, administration, and the business office. In many facilities, admission decisions are made by a team that may include administration, nursing leadership, and financial staff. Each member of the team reviews different aspects of the referral to determine whether the admission is appropriate. This collaborative process helps ensure that both clinical and financial considerations are evaluated. Once the referral is accepted, the information gathered during referral review helps guide the next steps. Diagnoses, documentation needs, and potential PDPM drivers have already been identified. This preparation makes the admission assessment and MDS workflow much easier once the resident arrives. Skilled admission reviews are one of the most important parts of the MDS workflow. When referral review is structured and thorough, it helps ensure the admission is appropriate and that the documentation needed for the resident's stay has already been identified. This preparation makes the rest of the MDS process much easier to manage. If you're looking for tools or other resources to aid you on your MDS journey, check out our shop at 5starmdsnavigator.gumroad.com or come see us on Etsy at 5star Navigator.